Nick, good evening and welcome.
Thank you, Madam Chairwoman, members of the committee. My name is Nicholas Oliver. I'm the Executive Director of the Rhode Island Partnership for Home Care. My association represents personal care, home health, home infusion, palliative care, and hospice providers. I'm going to try to act like Moses and try to part the seas as we just want to express some concerns with the bill, not necessarily take a hardline position in either way. Within my written testimony, I provided the committee with information related to hospice utilization by state. This is reported by the U.S. Center for Medicare and Medicaid Services. In short, Rhode Island ranks 33rd in the nation, down from 30th in the previous year, and remains at just only a 65-day average for utilization of hospice care. That's a third of the 6-month or 180-day benefit for end-of-life care. What that really means for Rhode Island is that physician practices and hospitals are not adequately informing terminally ill patients of their end-of-life options. So we as the industry can certainly understand why there are interested parties seeking this proposed approach. There just is insufficient options counseling upon diagnosis of a terminal illness and throughout end-of-life. Hospice can provide pain management, palliative care, and symptom management in a patient's home to provide patients and families support, enhance quality of life options at end of life, and even support one's spiritual needs if that's something that's important to them. Our Department of Health and our physician community needs to invest more time and support toward options counseling that includes hospice and palliative care before passing this bill. However, if the bill moves forward, and we understand that there's a difference between the two bills, the additional information within 320 that deals with pronouncement is not something that we have an issue with, other than there is duplicative language as it relates to a physician and a hospice medical director being able to do pronouncement. In Rhode Island, under Department of Health licensure, a medical director in a hospice has to be a licensed physician. So it's just duplicative language, but no real issue. But if the bill is going to pass, we would like to respectfully request that the bill sponsor, and of course you as the committee, consider the two proposed amendments that are on page 2 of my testimony. They are related to expanding options counseling and separately expanding the list of protected individuals that are licensed by the health department to include licensed nurse assistants, or as we know more commonly as CNAs. Thank you.
Thank you. And Nick, could you just discuss those options with the sponsor at some point so we can see what her feelings are on those?
Yes, I spoke briefly with Senator Golden before my testimony.